Good morning. Thank you for joining us today for our webinar, Benefit Programs, How to Choose the Right Partners. I am Melina Cambizzi, the Senior Vice President of Business Development and Strategic Marketing here at the Alliance. So this is the time of year when you may be considering making changes to your benefit program and looking for new ideas. If so, you've come to the right place, and we're thrilled to see so many have joined us today. About 175 folks have registered for this webinar. So thank you and welcome. A couple of housekeeping issues or notes. You're all in mute mode, but of course we still want to hear from you. So please use the chat feature to ask your questions or get help with any technical challenges you may be experiencing. You can download the handouts directly from this GoToWebinar platform. For brokers in our audience, if you wish to claim CE credits for this event, please download and sign a copy of the affidavit. The recorded video of today's event will also be made available for on-demand viewing from the events page on our website, and we will email a link to all attendees next week. Now, before we get started, it's my honor to welcome and thank our year-long sponsors, Delta Dental and National Cooperative RX. We really appreciate their ongoing support that allows us to continue to bring these valuable programs to you, our employers, and our partners. Today, our goal is to help you learn what to look for when choosing a partner for your benefit or partners for your benefit program. The right partners can make all the difference. Not only is your benefit program a significant percentage of your budget, but it also contributes to helping your employees and their families stay healthy and productive. And when it comes to attracting and retaining talent, it's also your benefits that add value and make your company stand out. So in this session, we'll define who our health plan partners are, what an ideal partner looks like, when it's time to change partnerships, and the top 10 things to consider when choosing health plan partners. You'll also learn real-world strategies from our panelists and ideas from our expert panel on customizing your plan and reducing your costs. Hear firsthand what they've experienced and what action they've taken in the pursuit of the best benefit plan design. And so to begin, I would like to introduce our panelists. So gentlemen, if you don't mind joining us now, thank you for taking time to be with us today. We're excited to get your perspectives on the methods you're using and the lessons you've learned along the way when choosing your health plan partners. So joining us today, Brian Adesso, who is the Director of Business Services of the Menasha Joint School District. He manages the financial aspects of the district. So in addition to healthcare, which is, as we said, a very big item in everybody's budget, his responsibilities is to support and manage transportation, food service, and also the building and the grounds. One important thing to note about Brian is how he revolutionized the Menasha Joint School District's food service program. It's a really very interesting story. After several years of research, he facilitated a partnership with Fork Farms, which allows the school district to grow their own produce year-round. Let's see if I can get this word right, hydroponically, equating to substantial savings for the district. The Menasha Joint School District is not an employer member of the Alliance, although, Brian, you know, I would love to have you join us. We asked Brian to be with us today, and we wanted to have a balanced panel of employers. I'm putting him on the spot, who can be truly objective and not just always invite employers that choose to work with us. I want to finish my introduction by giving you, everybody, a quote that I heard from Brian, and I'm actually using it. I'm saying to everybody that it's your quote, but I'm using it. So Brian, as we were preparing, Brian said to us, we're in the business of kids. So healthcare is very important to us because we want to take care of our kids and their families. Thank you for that passion, Brian. Jeremy Ott is next, and Jeremy has been the Vice President of Health Insurance Economics at WPS since March of 2016. It's a very big job, and Jeremy and the Alliance team and his team work very closely together in a lot of innovations. He currently oversees a cross-functional team focusing on developing and implementing innovative strategies to lower the cost of healthcare and improve member experience. Jeremy's previous roles in underwriting and sales helps him bring a unique perspective to his work. And while many of you may think of WPS as an insurance company or a TPA, they're also an employer member of the Alliance, one of our larger ones, actually. And Jeremy has been intimately involved in testing new strategies for their employees. So we're hoping, we know he can provide a few different perspectives. Last but certainly not least, a relatively new friend of mine at the Alliance, I would like to welcome Mike Tomczak. Mike is not only an employer member with the Alliance, but also an Alliance board member. Mike has been with Colby Windows and Doors since 1992. He's been known to deliver windows to clients. I love that. He currently oversees all financial functions and fleet operations for the organization. Mike was also actively engaged with the North Central Healthcare Alliance, NEHA, for 25 years, serving as its president for almost a decade. So throughout his career, Mike has been instrumental in driving healthcare innovation and change in North Central Wisconsin. So again, thank you all for taking time to talk with us today. So I gave our audience a short snapshot of who you are, but I'd like each one of you to take about 5 minutes to tell us more specifically about your organization and the type of benefit plan you offer to your employees and their families. So what I'd love to know is how you structured your plan, what costs are being saved, who you've chosen to partner with to make your benefit plan a win-win for both your organization and your employees and their families. Brian, I'm going to start with you and then ask Jeremy and Mike to give their perspective as well, if that's okay.
Thank you, Melina. So I'll start with where our journey started. So we started 2 years ago. We noticed that it wasn't sustainable to continue to get 10 to 20% increases on our fully insured platform. So we chose to migrate to a self-funded 2.0 plan. And the definition for us for a 2.0 plan is something that moves beyond just DPC. It includes multiple RX solution, it includes tier structured for copays, it includes direct contracting, care navigation, wellness, and more. So now kind of go into those items. For our DPC, we utilize Neopath. They're 100% customizable. To me, that means that they don't have products or things that they can plug in. They build them for their individual clients, which is very important for us because to me, everyone's different. Everyone has different needs, and they really support us in that venture to 2.0 model. For the RX multiple solutions, we're utilizing Scout RX. They provide tools like patient assistance program, copay plan, international program. Implementing that had a 34% decrease in spend on RX, which equated to a $500,000 savings. So that was over our fully insured plan. Our tier structure, we have 3 tiers. Tier 1 is our no cost, so that would be our direct contracts in our clinic. Tier 2 is a network, and Tier 3 is out of network, which is reference based. To help us manage those tiers, we partner with Prairie States. They do a great job on the back end for us with all of our customizations that we have going on. They also provide 100% transparency in the data, and they provide any data that we ask for to get the job done. They also provide excellent customer service called 5-star. I was taken aback by our employees on how many compliments they gave 5-star for their work in customer service. Because really, who likes customer service? Like no one. So to hear compliments about that, it's pretty amazing. Our max out of pocket, so we don't have a deductible, it's a full copay only. So our max out of pocket, we do have 2 plans for ACA reasons, for affordability for some of our employees. Really the only difference is we double everything. So plan 1 is a $2,000, $4,000 out of pocket, and our employees contribute 10.5% for that. And then plan 2 is a $4,000, $8,000, and our employees contribute 4% for that. For direct contracts, We do contract and we do bring on new providers monthly, if not more frequently. We partner with the EHCW for that. It's the Employee Healthcare Cooperative of Wisconsin. Right now, that group has 12,000 belly buttons within 50 miles of the Fox Valley. We just signed up a new employer today, and we have 2 to 3 more in the hopper. And why I bring up the belly buttons, and the Alliance knows this too, is that the more members you have in a certain area, the better pricing you can get. And you can also attract providers from outside the area, because providers want to be in an area where they'll have air quotes guaranteed patients to use their services. But with a tier structure, you can almost guarantee that they'll get that utilization because people are going to get free care instead of having to pay for it. The medical savings was a 20% decrease, or $1.1 million over the fully insured. Care navigation is the next piece. This is very critical for our plan because we do have a lot of partners, and we don't want our employees to get confused by those partners. So they really use the care navigation for one point of contact along with 5-star to get to the right places that they need to go. So we utilize collaborative care right now for that, and they really focus on the best quality care and then the cost, which most of you know is already pretty common, that the lowest cost provider is usually the highest quality provider, which is weird. I get that, but that's just how healthcare works. We signed up with them on July 1st of this year. They've already helped several people that have been diagnosed with cancer, navigating that treatment plan, which is very complex, and getting to the right providers that can provide that top quality care, provide the solutions needed to get them healthy as quickly as possible. They do have the ability to elevate tier 2 or tier 3 providers to tier 1, so saving our employees money if they follow the directions. So that could be for if we don't have a contract yet for a tier 2, or maybe the services are only provided in a system, and one system is much lower cost than the other system. And then our members work with skilled nurses to find that care, and they kind of, again, like the name says, they collaborate it. So they're really bringing in all the healthcare, looking at everything, looking at the risks, and help our members. Wellness, I'm torn about talking about with wellness because it's always ROI this, ROI that. You're going to save everything, and to me, those numbers are all funny numbers because it's always on time off or this or that. And I do think ours is unique because ours is done through mobile health team, and a doctor of lipidology is actually the doctor behind it. So when you have really bad lipid panels or cholesterol, this is who you would go to for severe cases. So they're managing our wellness program. We do have a health coach, a nutritionist, health risk assessment that is done through that team. And I really see this service as she's really our doctor for the employer and for the employees. So she looks at everything and makes sure that we're a healthy group of individuals. And then the last partner is our strategist. So we don't have a true consultant attached to our health plan. We have a strategist, and that's NBS Advisors, Sarah Hamus. And really, she's the mastermind behind the scenes. She's helped put this all together. We wouldn't be where we are today without her. But I will say that we both push each other to look at healthcare in a different way. And neither is right or wrong. We just want to push people more. I think I have time. I'll kind of reveal the secret sauce. I'm not sure if I can, but I will. The sauce is, I mean, we have a lot of partners, but our partners are all willing to work with each other. They're not one is better than that. We don't want to share data. They all come together. When we have meeting phone calls, we regularly have 3 to 4 partners on the phone trying to solve that one issue. And it may not pertain to all of them, but we all have different viewpoints. We all have different strategies. So it's been very, very beneficial to have partners that are willing to take down their walls of defense on another company coming in. And then I'll end with overall, we've had a 15% decrease, which is a $1.1 million savings. Again, I know that the math doesn't add up for those that are good at math, but the piece in there is we're missing that we added a clinic, and I'll talk a little bit more about the clinic later on. And then we utilize Health Rosetta, and they introduced a tool called Plan Grader. And just this week, we got back our plan grade. So it's out of 100. We got a 91 out of 100. And the median score for that is 55. So the score demonstrates a high-performing health plan. And just so if you don't know, Health Rosetta's really mission is to scale the adoption of fixes for healthcare that really already exist out there. So thank you.
That is fantastic. Again, congratulations. Brian shared with us before. Brian, just a small clarification. The wellness program is run by Neopath. Is that what you were saying?
Nope, the wellness program is run by Mobile Health Team. So we have a separate, yeah. I mean, our clinic provider does provide a wellness program, but I don't like too many services with one provider. I mean, our wellness provider really specializes in wellness.
Fantastic. Thank you. We'll talk more about that. Jeremy, I'll invite you in then.
Yeah, good morning. Thank you so much for having me be part of this panel this morning. I thought I'd start off just talking a little bit about WPS, who we are for people that may not know. I think most people that are on this call know of us as a not-for-profit insurance company that offers both commercial, fully insured and self-funded products, mainly inside the state of Wisconsin. But we also have two large divisions that process claims for both Medicare and TRICARE programs, which is the military, which makes WPS one of the largest claims processors in the entire country. We have just over 2,500 employees with just under 2,000 employees covered under our health plan. Of those that are covered, about 60% of our workforce is located here in Wisconsin. Almost all of the ones that focus on our commercial products, as well as some of our government programs, are located here in Wisconsin. But one of the things that makes us a little bit unique is obviously with COVID, a lot of us had to change the way we did business. And with COVID, we went to a remote environment, and as the restrictions have let up a little bit, we've remained in a remote environment, and about 97% of our workforce today continues to work remotely. So it's definitely made us take a look at our benefits. I'll get into later some of the changes we've had to make to accommodate some of that work at home environment. But in regards to how our health plan is structured, it's really focused on trying to find ways to help members and their employees and their family members make high value decisions. We try to create incentives and whether that be financial or lower out-of-pocket costs for members to make those high value decisions. And with our health plan, we actually created a 4-tier network design that actually we were able to lower the out-of-pocket cost for our members when they did choose those high value decisions. And so the basis of our program was we utilized the Alliance and offered a traditional in and out of network plan design, where with our employees being scattered around the state, we were actually able to incorporate the Alliance's network and wrap it with our WPS statewide network, which gave us a statewide solution that was able to cover all of our employees. And so that was something that we really needed, since we were starting to recruit more and more people outside of the Dane County area with the work at home requirements. But in addition to just offering the traditional Alliance network, what we did last year was implement the Alliance Premier Network. And what that did was actually allowed us to lower the out-of-pocket cost for members that went and saw a Premier network provider. So we were able to keep all the other benefit levels at the same level and actually reduce and still save money with the additional claim savings that we were able to generate from utilizing the Premier network. But we didn't just stop there with the Premier network. We actually added a 4th tier of network, a 4th tier to our network, which we refer to as Tier 0. And this is where the Alliance has been a tremendous partner with WPS. We noticed that our organization and the Alliance had a lot of the same initiatives going on to try to identify high value care for our members. And so we actually worked really closely together to identify high value providers. And what happens is if a member does go to a Tier 0 provider, we waive all out-of-pocket costs for that member to access that care. So I'll give a personal example of my own. Last year, to start the year, I tore my meniscus. I knew as soon as I went into to see my primary care doctor that I was very likely going to need an MRI. I needed to confirm that, which was the case. Once he gave me the referral for the MRI, he encouraged me to go down the hall to get the MRI. I knew if I got it in that office visit setting, that MRI was going to cost me probably $2,800, which since it was the beginning of the year, the vast majority of that would have came out of my pocket with deductible and out-of-pocket costs. So I actually took the referral, was able to identify an independent imaging center that we had placed in our tier 0. And instead of paying $2,800, I would have paid in that office visit. It cost less than $900, and it cost me nothing out of my pocket, and it cost WPS less to cover that service by utilizing an independent imaging system. So that's just one example of a lot of different types of things that we've included in that tier 0. Some other things that we implemented as part of that tier 0, we've really focused on implementing bundle purchasing. A lot of our bundles we've got access to through an organization called Novo. They've been a great partner of us and offer significant savings at high quality for members that are willing to utilize a Novo provider. And now we're starting to implement even more bundled services through an organization called Holista that's looking to expand some of those bundled providers and really adding a lot of benefit to us. We're actually seeing such significant savings on some of those bundled procedures that not only can we offer them at no out-of-pocket cost to our membership, but we can also offer cash incentives on top of that. So we can actually pay somebody to get a procedure done at one of those bundled services and still ultimately end up saving money for the health plan. So those have been great additions that we've added to our plan over the course of time. One of the other key things that came out of COVID that was a big strategic focus for WPS was around the concept of behavioral health, mental health. It was a big focus of ours, and it continues to be a big focus of WPS going forward. And so one of the things we wanted to focus on was identifying a way to make access to mental health easy and affordable for members. And so last year, we actually also implemented a zero cost, out-of-pocket cost option for our employees and their dependents to access teledoc behavioral health at no cost. So it was very convenient, all done via video through teledoc, and that's been a tremendous success for our members, both from the ease of getting access and also making it affordable for members to be able to have access to behavioral health. So those are some of the plan design things that we've done for our health plan, but I'll tell you the plan design by itself isn't enough to drive the care. Similar to what Brian said, we did identify that we need to give our employees some tools for some of these programs to be successful as well. So we also did partner with a concierge service level or service provider. We partnered with Alethius, another Wisconsin-based company that can help our members to navigate the very complicated healthcare industry that we're in. So if a member needs something or they leave their office from their primary care doctor and need to go see somebody, they have a single contact, a single phone number that they can call and reach out to and help them identify other high value providers that they might have access to that will help them maximize their health plan as well through that. I'll just hit on a couple more strategic partnerships that we've added. One I'm going to bring up that we just implemented this year, so I don't have any great ROI to share with you, but we've partnered with an organization called SWORD to really help us address musculoskeletal costs. You're probably thinking an insurance company, why are you worried about musculoskeletal costs? We're not a manufacturing, whatever, but just like every organization that I work with, musculoskeletal costs are always at the top, and it's no different for us either. SWORD is really a digital web-based or mobile-based application. And I bring this one up, like I said, I don't have results to share, but I can tell you the engagement we've had from our members on this program has been one of the highest, if not the highest engagement that we've seen with any program we have. I think every time you roll out one of these programs as what the person that's being part of recommending it, you're always worried about the engagement and what you might ultimately get. And this has been a home run up to this point for us from an engagement perspective. And the feedback that we've gotten from the people that have utilized it has just been tremendous. And we're really looking forward to seeing how that can help us down the road from an ROI perspective. So those are some of the key things that we've done for our health plan over the last couple of years that have really helped us move the needle and drive our members to get access to high value care.
Do you mind if I make a couple comments, Jeremy? So
Absolutely.
A comment and a question. So I know Jeremy's journey last year, and he unfortunately had to go out of town to get his MRI done. But just a little plug here. We are getting 2 MRI providers in Madison, in Dane County. So for those of us who are in Dane County, we don't need to go to Milwaukee anymore. MH Imaging is expanding their services in Dane County. They're open. Actually, they're not just doing MRIs, but CT scans, X-rays, and ultrasounds. And so along, when Jeremy said MSK, musculoskeletal, along with that, all of these services come up to the kind of the highest level of expenditure for self-funded employers. So MH Imaging is opening up end of May, and then later on in June, Smart Scan MRI and Smart Infusions are also opening up. So as well as we're working with next 12 months, I believe we're going to see an ambulatory surgery center in Dane County that does orthopedic procedures. So that was my comment. I just wanted to remind everybody, and please watch our website because we will be announcing this. But Jeremy, also your employees are using Pivotal Health, which is an in-home primary care, urgent care provider. And I'm hearing great things about them as well, right?
Yeah, we've had a number of people that have utilized Pivotal Health, like you said, at home type of service. The feedback that we've gotten from the members that have used it, they've been the best promotional people for that organization. They just speak very highly of it, and it's something we're encouraging and trying to figure out how we can drive more business to them. Just because, like we said before, with the work at home environment we have, if people are able to get care right at their homes, it makes it even easier in today's day and age. So yes, I would agree that's a great vendor that we've tried to utilize even more.
Thank you, Jeremy. Mike, I welcome you.
Well, good morning, everyone. Glad to have you on board today. Colby is headquartered in Wausau, Wisconsin, and the bulk of our employees are in the Wausau area. And unfortunately, that market is kind of dominated by 2 competing systems. So over the last, 30 years that I've been involved, you really find that innovation goes at a little slower pace than the metro areas of like Dane County, Milwaukee, and even in the Fox Valley. When I first got here in the 1990s, there were independent providers and practices here in town, and it seems like either they got bought out or they made sure that they flew the flag and got somehow affiliated with one of those 2 systems. So it made it a little bit frustrating for me as an employer, and several of our other employers here in town as well. And as Brian stated earlier, you look at the cost trend and you go, well, this is not sustainable. And so a group of employers here in town, including Colby, we founded the North Central Employers Healthcare Alliance, and which is which banded together the Central Wisconsin employers, kind of like the way the Alliance does it now on a statewide network. And we, tried to have a lot of dialogue with the providers, try to get close to them and try to understand. And for the most part, we had some success bending that curve a little bit, but really to really start saving money back in 2006, our alliance offered what was called a dual choice offering. Against, we really made the employees elect which system that they were going to receive the majority of their care in. And so you basically enrolled in either, the network that was going to be offered by provider A or provider B, and then obviously your ancillary providers fill in on that. So tier 1, was scheduled to be that if the enrolled network that you had chosen, and tier 2 would be the competing network, or else we'd call it the crossover network, and then we had traditional tier 3. And what we did is we found that using that promise, let's say, of steerage, it really helped us negotiate a lot better rates with those providers than the NEHA broad network that we had at the time. And the other feature of that is starting to save some money for the employers and the employees, is that by having those employees in the enrolled network and kind of stressing that, stay and get your care in your network, we found that then we could measure the PMPM by network and have active discussions with the care providers about, hey, your trend is either, well, obviously, worse than the other guy in town, but it also enabled us to even get down to where toward the end, we were looking at downright episodes of care. So we could say that, if you needed a knee replacement, system A would be better than system B. And if you needed, gastro work, maybe network B was a better choice. So we could inform the employers and help them structure the benefit plans as they wanted to try to save the most money for their folks. So, our success on that, we kind of always benchmarked ourselves against what Milliman had for costs in north central Wisconsin, and the NEHA employers were consistently under that. So we think we've done a good job saving money over the years. At Colby, we started our own on-site clinic in 2012. And again, with that big group of people here, it was very cost effective to have that nurse practitioner and an RN on site. So I started seeing a lot of our employees. We had, we were happy that we had 15–20% of the people that said, my primary care is that doc at the clinic. So that was nice to see. But being in manufacturing, and as was discussed earlier about, musculoskeletal injuries, we really went with more of a holistic approach on the clinic by offering OT and PT services as well. And we found that when those, especially the occupational therapists, preemptively were able to get out on the floor, they could manage some of the work comp exposures that we had out there. And so using those folks, and plus the fact that our provider contracts allowed for discounted services on the work comp claims, they were really drivers to getting our work comp experience mod down to like 0.7. And sometimes people forget about that there's that whole other piece of cost out there as far as the work comp claims. So we're able to kind of attack both the medical front and the work comp as well. Let's see what else. Our plan is kind of structured with relatively low deductibles for both a traditional PPO plan option or a high deductible option. We make it very clear that we want to have deductibles low, but the out-of-pocket costs will be relatively high and pretty much close to the ACA max. And we kind of stress that we want to allocate the cost of the plan to the people who are using it. Therefore, you got incentives to keep yourself healthy and save yourself money. So we really push that really hard with folks. Because of the high deductible plan, it has limited us into being able to give some of the free care. But as far as our benefit partners go, this year we started with using Holista bundles and Novo Health at the Alliance. And so the way we operate with that, it's really a cash reward, which will more than cover the cost of their copay that they would have. So we do that. We use UMR for our medical TPA. It's very handy having their headquarters right here in town. We use ServuRx. They're based out of Milwaukee for the PBM. And as Brian said, I kind of got the full suite of services to make sure you're in step therapy and the generic substitution and the patient copay assistance that gets applied toward our share. So that's kind of helped on the drug costs, but again, we really realize we need to do something more there to save even more money as we go forward. We use for our wellness plan, we use Aspirus Business Health. They had bought Ministry Business Health earlier, and we had a long relationship with them back from when we started the clinic. But I guess probably the biggest hurdle that we end up facing today is, how do you get plan participants engaged? Again, we don't have an area there that there's a lot of new providers coming in until recently. So to get those people to say, hey, shop around, you might be able to find healthcare cheaper in the Valley or go down to Madison. So that's really been tough. So I, like some of the people here on the webinar today, are going to be out looking for a benefit partner to kind of solve that care navigation piece, because again, you can have everything set up nicely. You can even have great incentives, but sometimes it's still tough to get people after they've seen that same doc for a lot of years to say, hey, I don't want to get my knee done here. I'm going to go look in the valley and I can find I can get it done a lot cheaper at a place like Noble Health. So that's going to be an ongoing concern to how do you get the people engaged. And that's about it, Melina.
Thank you all for sharing your stories, giving us a peek behind the scenes into your design strategies and which partners have been key to your success. For the audience, you can tell that we're defining benefit plan partners, health plan partners very broadly. Of course, we include here TPAs, third-party administrators, PBMs. We're also including the idea of on-site clinics, consultant brokers, wellness partners, care navigation into this plan partner category. But for today's discussion, that's what we will be referring to. So with that, now that we know what we're talking about and we have a little bit of your history, let's start with, we got this question from several folks. What does an ideal health plan partner look like? What criteria do you use to select them? And I will start with Brian, because Brian, I'm just fascinated with your strategy of your local pharmacy connection and some of the work you've done there. So do you mind if I put you on the spot first?
Yeah, my pleasure. Yeah, I kind of took the micro approach down to a really detailed thing instead of looking at the big picture. So we're working with a local pharmacy provider. I didn't get permission to use their name, so I'm not going to use their name. I think that they'd be fine, but I don't want them to be swamped either with work. But this is their kind of business vision plan. So they offer some programs to us. They offer a PBM bypass program. So what it is what it says. It's any script under a certain dollar amount doesn't get submitted to the PBM. The district pays for it directly. And then through that program, we're able to get insulin for $99 or less, which just for reference, we do international. It's over $1,000 savings versus international, just for your reference, because everyone hears that Canada is super cheap, and they are. It's just this program is much better. They also offer medical review sessions to make sure that they're not conflicting or anything. And they've really been a great partner because they were able to highlight from the pharmacy side of the view, so the boots on the ground, and how we can work with them and improve our plan. So, and again, they've been one of our partners. They've been working with our other groups. They are able to deliver right to our clinic. Our clinic does have its own drugs. But for some of the stuff, they can, if it's easier for the patient or the employee, they provide a great customer service. And really their motto is that they treat everyone like their grandma. And they really do. I mean, even if you're not on a plan, they'll get you enrolled into the insulin program, like without even you asking for it. That's just how they are. So they're an independent pharmacy. He came from one of the big retail pharmacies and just was not happy with how that worked. So he wanted to fix the system. So we look, I don't want to say change agents, but we look for people that want to do the right thing.
Thanks, Brian. Jeremy, your thoughts and general criteria to my questions?
Yeah, I'll just take what Brian just said more broadly. I think you need to be looking for benefit partners that are willing to think outside of the box. I hate to say it for everybody that's on this call, but if you're looking for one solution that fits everybody's needs and is going to solve the problem, it doesn't exist. And I think while you hear a lot of similar themes between Mike and Brian and I and what we've done in our health plans, how we've rolled them out and how we've implemented them for our different needs are different, and that's going to be the case. And so having somebody that's willing to think outside of the box and address the problems for your organization, I think is huge. And then also they need to be not only thinking about today's problems, but be thinking about what's on the horizon as well. I tell groups all the time, in my mind, if you take specialty drugs, for example, there's two types of groups. There's groups that are dealing with specialty drugs as a problem today, or those that will be dealing with specialty drug problems in the future. And so you know, if you're not proactively thinking about those types of things, and that's just one example, there's probably a dozen different things that they should be thinking about future, and make sure that you're prepared for that rather than being reactive, because it's so hard to make changes when you're being reactive versus being proactive from that perspective. The other big thing that I look for in an ideal partner is somebody that that takes communication seriously. Somebody that's willing to meet with you regular for updates and meet with your employees as well. They should be really engaged, helping you develop a communication plans to educate your employees. Let's be honest, healthcare is really complicated, and you know, you shouldn't feel like you have to do all this by yourself. You should have the right partners that are part of this, that are kind of being an extension of the benefits team and being able to help support that. So those are just a couple of key things that I look for when I'm looking for benefit partners.
Thank you, Jeremy and Mike.
Well, Jeremy and Brian did a great job summarizing a lot of it, but I would certainly say that, you know, the accessibility is kind of key, because, you know, it seems like in the HR world, when you got issues, they need to be addressed right away, and you know, you need to have somebody who's there and is willing to pick up the phone and roll up their sleeves and help you with the problem. And again, so they got to be really committed to your firm as well. So.
Mike, I'm going to stay with you for a little while longer. What are some of the things to be aware of that can signal your current partner isn't working in your best interest? I'm interested in a lot of, I'm of course always interested, but a lot of our audiences I'm seeing is interested about transparency. So, you know, how do you define, how can you find transparency, and how, when things are not really working to the best interest of your health plan, what do you do? What are the signals, and what do you do?
Well, I guess I interpret that as two questions, and I guess I'll do the transparency thing first. You know, a lot of times, you know, it's kind of danced around, and you need transparency both in your data and how your partner is being compensated. And, you know, frankly, you have to be able to demand that. And if you don't, you know, that's the first signal. Or if you demand it and you don't get answers, that's the first signal that maybe there is something going wrong. And to kind of echo that, again, other signals that say that maybe there's some issues when you stop getting creative ideas. I've always told my partners that I says, you know, you bring me the ideas, and if I don't want to do them, then it's on me. But if I find out there's something going on out there and you go, well, I didn't think you'd be interested. Well, those people are going to get skewered. That's for sure. They're going to get barbecued for lunch. Again, it's up to those guys to stay on top of the industry trends, and kind of like Jeremy had said too, what's the vision going forward? What do you think is coming down the pike that we need to start planning on now? And if you're not getting good dialogue, in addition to the nuts and bolts everyday work that you need to have done, if you don't have some of that broader stuff done, you really need to start questioning whether that partner is doing the right thing for you.
Jeremy?
Yeah, I think I would build on that a little bit as well. I think some of the things, if your partner is limiting your ability to be flexible and bring in best-in-class solutions, or they're encouraging you not to move forward or thinking outside of the box, then you're probably with the wrong partner. Or if they make it very expensive for you to do those types of things, or make it very difficult, probably not the right partner to be working with. And I think both Mike and Brian hit on the PBM. I'll use that as an example. There's a lot of great solutions out there, but I've heard of some you know, benefits administrators that charge enormous integration fees to integrate with these PBMs. I heard one yesterday from an agent that I was talking to that said they were charging $15 per employee to carve out the PBM. Well, if they're doing that, they probably don't have your best interest at heart. Now, I say that with the caveat, there is administrative work, there is some things that need to be done. So having a reasonable fee makes sense, but some of these fees just aren't reasonable. And if they're making it difficult to work with, then they probably don't have your best interest at heart. And so that's one red flag that I would keep an eye out on. The other one that I think is big too, if it's difficult or a challenge for you as an employer that's self-funded to get access to your claims data, that's a problem. That it's your data. It's your plan. you should easily have access to it. And so if you need data, we talked about a lot of the vendors that we partner with. In order for them to get a good analysis or to get a good feel for what the value they can bring to you, a lot of them need access to data to do it. And if you can't get access to your data, or it becomes challenging, or they're just not willing to share it, then once again, they're probably not the right partner, and they're probably not looking out for your long-term best interests. So I think those are a couple of things that I would point out.
And Brian, you've also, if I recall, in the past, you've had some issues about getting data as well, right? Any thoughts on that?
Yeah, I would just advise people just be questioning, be inquisitive. No question should be seen as stupid. Ask the questions. If your provider's not providing you the answers, that would worry me. 15 years ago, we had a consultant that was very transparent with the fees, and they actually provided me the insurance company's override documentation that their agency gets. So it says, if you bring me 10% more clients, we're going to give you this much more money, just so people understand it. And that wasn't heard of back then. But that was an ultimate transparent consultant. And again, a lot of the consultants we work with, they may not know their agency, and they may not be pushing for it, but the agency on the back end is most likely pushing for it. So I would say to ask questions, get the data. If you're not getting the data, it's probably time for a change.
I guess I'd say, again, kind of using what we use in manufacturing on our lean tools is when you got a problem, you got to ask why, usually 5 times to get the right answer. So again, you might come off as a little, probing when you say, okay, I got this issue, and then they tell you something, you say, well, why is that? And you usually find out that you got to ask why a number of times. So don't be afraid to do that.
So speak up, right? Speak up, because it is our fiduciary responsibility to the health plan and to our employees to speak up, right?
Correct.
So we would like to hear from the audience as well. So we're gonna do our first polling question. Barb, if you could bring it up. Yes, thank you. Who do you rely the most for shaping your benefit plan design? And you can select one here: consultant, broker, third-party administrator, network, other. It's just me. I need to find someone to help. I'll give you a couple of seconds. Do we have an answer to our poll? So 76% of our audience use a consultant broker, 12% a third-party administrator, and the rest is much less. So, yep, thank you all. All right, so back to our questions. Give me a second to set up, I apologize. Jeremy, I'm coming back to you. What advice can you give to someone that's just getting started?
Yeah, some of this I hit on already. I think the first thing you need to understand is that every organization is going to be different, and you really need to understand, your culture, what's going to work within your organization, and that will help you kind of put together what's going to work. And so I think the first thing you need to do is be clear on the problem you're trying to solve. So some employers might be in a place where they just need to find the lowest net cost, and they need to drive down cost, and that's your main objective. Others might be in a slightly different place where they're just trying to help their employees find access to higher value care as part of the underlying plan. But my guess is that most of you are probably in some kind of a hybrid of that, right? Somewhere in between. But I think you really just need to be really clear on the problem you're trying to solve, because from there, I think you can sit down and start developing a plan to get that. And when you're developing your plan, I would highly recommend that you sit down and really create a list of guiding principles that are going to lead you through this journey, and really try to identify a few strategic targets that you want to go after. Because I would say if you don't have a plan or you don't have targets, this can get overwhelming really quick, because it is like boiling the ocean, and it can start to become a challenge. So I'd really start there. And then the last thing I would do, and we've kind of alluded to this a little bit as well, I would find the best benefit advisor you can to partner with, and that's going to allow you to help execute on that plan. You don't need to do this alone. You shouldn't do this alone. You should find the right partners that are going to help support you and help drive that. And whether that's through a broker, whether that's through a TPA, whether that's through a great network partner like the Alliance, find the right benefit advisors that are going to help you navigate that and really help you get that off the ground.
Awesome. Thanks, Jeremy. Let's go a little deeper into plan design, as you all are offering tiered benefit designs. So what tips can you offer for those interested in tiered benefits? Mike, we'll start with you and then go to Brian and Jeremy.
Okay. Well, as I had said earlier, our tiering is kind of, just based on, forcing people to get in an enrolled network. I guess the big thing is a lot of folks will be hesitant about trying to with tiers. And again, the old-fashioned way is just have a broad network, and that way all the employees are always happy. And when we went to the, tiered or dual choice option back in 2006, we were worried that, is there going to be a mutiny amongst the employees? Because now, you just can't go to anybody in town. You really find out that if you communicate it to the employees why you're doing the tiered strategy, how it can save them and themselves money, don't sweat it. It'll come off okay. We've had a lot of people that I've in NEHA where it said, well, should I do this? And they're always worried about that. So I guess that's my side on the tiering there that I'd like to offer.
Brian, your thoughts on tiered benefits?
Yeah, I just want to piggyback on what Mike said because it's very important. It's the communicate. And we rolled this out 2 years ago, and I'm starting to think that we did too good of a job communicating, because our employees will come to us and be like, well, there's no providers in the area, because they only think that there's tier 1 providers. And I said, no, like 99% of the providers in the area are covered. You just need to pay a copay. And well, I don't want to pay for it. Well, then you go to a tier 1. And I just want to say, you have to make that differential between the tiers, and that's different for every single employer. I tend to think that our employees listen to us really well. One quick example is that, we told all of our people to go to Shopko Pharmacy because they were a good cost. Well, Shopko went under, and we had over 60 people call our HR department and where should we get drugs now? And we had our employee base insures about 381. So we had a good percentage of people that cared that much that they wanted to know where do we go now. So our structure looks different than most, but you got to think about that.
Jeremy?
Yeah, I think I'll answer this one. I start where I left off my response to the last one. I think those that are interested in tiered benefits, the first thing you need to do is you need to leverage your partners to help you with it, whether that be your network, the Alliance, your TPA, your broker. I mean, they should be able to really help you craft what that ultimately is going to look like. But the other advice I would give is, just know that it's okay to start small. You don't have to try to do everything all at once. And in my opinion, the easiest place to start is really to compare costs at different facilities. The Alliance does a great job of helping you and supporting with that. Focus on commonly elective procedures that members can actually make a choice for when they need to have a service performed. Things like MRIs, CT scans, musculoskeletal surgeries, things like that. And really then just identify a couple preferred providers. Identify 2 to 3 providers in your specific geographic area. Or find bundles, ideally, if you can. I talked about bundles earlier that have significant savings as well that can help drive down some of the care. And so I think it's okay to start small and do something. In my last word of advice, I'll say, don't try to be perfect. It will evolve over time, and that's okay. I'll actually fully admit we were probably delayed in rolling out our programs to our employees because we were trying to come up with the perfect plan design, and sometimes I think trying to be too perfect can delay doing something. So don't feel like you have to be perfect right out of the bat. It should evolve over time as people get used to it and look. And so those are the things that I'd really focus on for people that are interested in this type of program.
Full disclosure to our audience, Menasha Joint School District, WPS, and the Alliance as an employer, we all have a tier of no cost to employees and their families. And just I want to interject kind of my own personal experience. Our employees love the fact, first, they don't believe that they're going to go get a service and they will pay nothing out of pocket above their monthly cost share, right? Monthly premium. And second, then once they get the experience, they love it. I will also say, because this is the first year that the Alliance is offering this, there are definitely kinks. So having the right people in charge of some of these programs and having the right partners, right? Like the right consultant, absolutely help, the right TPA, because the Alliance did a lot of work with WPS to be able to administer our pure copay plan, very similar to yours, Brian. A lot of work from both of the organizations. So there's going to be errors, there's going to be failures, there's going to be kinks. We're celebrating them, we're getting better, we're fixing them, and we're moving on. So thank you for that. Brian and Mike, I'm going to come to you to talk about your insights. You're both offering on-site clinics. So your insights for employers that are considering either direct primary care, we called it DPC before, or maybe on-site clinics. I'll start with Brian.
So with our tiered approach, I mean, it helps direct people into the DPC. We have a little bit of a different experience with DPCs. So this is our second attempt at a DPC. The first attempt went up in flames and then exploded. And so our second attempt was a very high risk, high reward situation, because if we didn't hit it out of the park, we'd probably never get another DPC on site. And one of the biggest things that we looked for is a DPC that allows you to be part of the process. So part of the interviews and hiring the providers, and not only the providers, but the support people, so that we know that they'll mesh with our people, because we know our people better than outside people. Again, the flexibility of doing whatever we want to do, not just we have this plug and play option, and this is what everyone gets. It's just, we like someone that can go with us through this journey. And then again, like our partner, they're not afraid to refer to another DPC to add, to help out. So they're taking business away from themselves just for the greater good of all. So, I mean, that's really what we look for. And someone that's independent, obviously, meaning not connected to a health system.
And I love your culture, because it's not, part of the culture is to celebrate these failures, right? Because we learn a lot, and that gives us an opportunity to do it the second time in a much better way. So I'm so appreciative of your culture, Brian. Thank you. Mike, you also have on-site clinics, and they've been very successful.
Yeah, again, we started ours in 2012, and kind of what Brian had said, I think it's important that you make sure that you're going to have a good fit with the providers that they want to put on site. They've got to be able to mesh with your people. Again, most of the folks are blue collar. So again, you've got to have somebody that can relate to that everyday person on the shop floor. So that's really important. And again, the continuity, you want to really ask that on-site provider how long their people are actually what the average is that they are assigned to that same employer. We've been very lucky here in, it would be 11 years, we've had 2 nurse practitioners, that's it. So, and one was moving out of town, and I think we're at 4 RNs. So, again, you also got to get off your chair and go over there once in a while and make those providers feel very comfortable, because they really become an extension of Colby for us. So we're always trying to have a dialogue with them and understand, what problems they have, what are they seeing for the main type of claims and all that kind of stuff. And as I had stressed earlier, that especially if you're in manufacturing or musculoskeletal is a concern. Sometimes people that are going to be in on-site clinic will not provide the therapy services, and we just find that having that whole team where the therapists and the RNs and the NPs all talk together and work together for any kind of problem that the employee might have, whether it's work related or not, it really has a huge benefit. So our surveys show that people are very satisfied with the clinic that we have. We did find over time that you also better find a provider who's flexible, because we're not open 5 days a week, 8 hours a day. We kind of stagger amongst the days, and some days we're open early and some days we're open late. So to try to accommodate what our employees' needs are. So, and I guess I'd also say that, if you do have a on-site clinic, try to make as much stuff as you can free. That can be a little bit of a challenge when you're seeing people who got a high deductible health plan, but there's a lot of stuff that can be done for free, even under a high deductible health plan. So we tout that, again, if you're in the PPO plan, anything you need over there is free. So that certainly helps drive the utilization.
Yeah, if
So
I can build
on
off what Mike just
Yeah.
said there, I completely agree. The plan design is crucial for the success of the on-site clinics. And for full disclosure, we don't have a on-site clinic at WPS, but I've had a lot of experience with them. One thing I'd add on as well for people that are interested or currently have one, either a direct primary care or an on-site clinic, one of the key things, in my opinion, is to find a provider that's also willing to work with you to refer care to other high-value providers when they can't perform the care in that setting. If there's certain things that they can't do and they're referring it out to a high-cost provider, you could actually start to see some counter-productive things coming out of there. And so it's really important, in my opinion, to have that on-site clinic in the physician or the nurse practitioners willing to work, whether it's with the TPA or the consultant or whoever you might be working with, to be able to help identify where the referrals can go for the high-value care that can't be done there.
Jeremy, that's a really great point. That's a really great point about the referrals. And we've just ran into some experiences with some providers being systematized. And by systematized, I mean they're used to 5-minute appointments, and anything that's wrong, they refer out. So it's a double-edged sword, but if they know the high-value ones, they can treat what they can treat. And then, also having appointments that are 30 to 60 minutes. The provider starts to say, what would I even do in that time? Probably not the right provider.
Yeah, true.
And Jeremy, just to continue on what you were saying, because at the Alliance, we've identified direct primary care providers for our employees and their families across Wisconsin and actually beyond, but also for our employers. And you're correct, you're all correct. One of the very first questions we ask them, we have a list of high-value providers. Are they willing to refer out of our list of high-value providers? That is important. How do we connect the data, the third-party administrator, the network, and also our independent providers? That is incredibly important. And surprisingly, there are some that have their own relationships and are not willing to use kind of the list that the Alliance has come up with in terms of high-value providers. So thank you for that. You've all been touching upon my next question, which is we have a great representation of different industries on this call. So we have Brian from the school public sector perspective, Jeremy, WPS, white collar primarily, and of course, Mike, manufacturing. Have you designed your benefit plans specific to the needs of your employees? And if yes, I assume it's yes. How so? Brian, this is where your great quote comes in, I think, that I've been using ever since I heard it. So I'm going to start with you.
Yeah, so I mean, we are about kids, and we're about people. I mean, we're a service industry. Yes, we're in education, but it's a service. We came up with a great benefit. We probably stole it from someone, but we offer 100% paid maternity. So that's from the first doctor's visit all the way through birth. So any provider that they want to go to. We just believe that it's important to have kids. Our funding comes from kids, but obviously our teachers don't all live in our community. So, but that's really important. Now we're actually looking at elevating that, and I stole this from another employer, that if they go to one of our lower cost or higher quality providers, we're looking at providing 6 to 12 months of diapers for that baby to help that family out. And again, because of our shortages and things, we need contracts that are close to home because we can't be away from the kids. So.
Thank you, Brian. Jeremy?
Yeah, this one has been an interesting one for us because when we started looking at this initiative to help members find high value, we were all working in our offices, and so we were really focusing on how do we drive to high value care that was located around our main campus in Madison. And as I said before, about 97% of our workforce is now remote, and so that's really made us take a step back and reevaluate how we do these things. And some of the things are just obvious. We needed to identify new high value providers that meet the needs of our expanding workforce. As the workforces in different regions, we had to identify more providers that we could add to tier 0 that may be outside of the Dane County's area, or that people could have they could have access to. So that's been one of the key things that we've really had to focus on, and that's still going to be evolving too as we learn more and more about the impacts that the remote work have on our members. We'll have to continue to evolve our benefit plan to keep up with that. One of the other challenges with remote work is it's made communication a lot more challenging. When we're in the office, we were really good about creating really fancy looking posters that we could put in the lunchrooms and have on the walls that everybody could access. Well, you don't have that anymore. So we've had to spend a lot more time creating digital communication, whether that be email, whether it be posting articles on our intranet page, and creating more contacts with members, just so these things are staying at their top of the mind. So those are the things we're looking at, and we'll continue to evolve those things as the environment that we have and our employees have changed.
And Mike, I know you talked a lot about occupational therapy, but additional thoughts?
Well, again, on plan design is how can you keep it simple? Again, especially it helps the blue collar people. Just give me something that's simple. Then you got the challenge, and how do you get them to high value providers? And again, we have not had a dearth of people locally in the Wausau area that will give the high value care. So now it's the education thing that is okay to go to the valley and things like that. And again, by having the cash incentives, kind of done that on the plan design to make that happen.
So before we continue, we have one more brief poll to find out how many of you are already customizing your plans. So what key strategies do you already use in your benefit plan design? Steering and tiering, guiding employees to use high value providers, on-site clinics, direct primary care, bundled pricing of episodes of care, or none of the above. I'm here for ideas, and you can select all that apply. We have some answers. Excellent. So 58% of our audience, folks, are steering and tiering. That is fantastic and actually very impressive. 32% are using on-site clinics, about 20% direct primary care, 45% bundled pricing, and 32, I'm here for ideas, and we welcome you. We love to share. You can tell we're very opinionated, so we love sharing our ideas and our opinions. So let me get back to my script like I did before. Let's now focus on the bottom line and on saving money. And I'm going back and forth on screens because there are some questions that are coming in, so I will address them in a second. But let's focus on the bottom line, saving money. So in today's competitive hiring market, high quality health benefit plan program can give employers an edge, but it's also a significant percentage of our budgets. What has it been like inside your organization? What has it been like inside your organization when steering employees to high value affordable providers? So let me start with Jeremy, and if you can talk a little bit about costs and savings.
Yeah, I'll hit on a couple of that. I think the important part of kind of talking about what it's been like. One lesson learned that I'll share with everybody, is that employee education and communication on these type of programs is vital to the success. And I think, just in full disclosure, I think working as a part of an insurance company, we may have made an assumption that our employees were a little bit more knowledgeable or might have a little bit more insight to some of these concepts than others. And I think that was a bad assumption early on. And so we've really had to double down on our educational efforts that we've had with our employees, because let's be honest, health insurance and healthcare the concepts are complex in what we're trying to explain here, and people need to hear it multiple times. It can't be something that you just talk about at your open enrollment meetings once a year and expect everybody to remember it. You know, because the biggest thing is that the average consumer of healthcare doesn't understand that there isn't a correlation between cost and quality in healthcare, just because it's so unique to the industry that we have. And, you know, an example of that is, you know, it's great with a lot of the legislation that's been done around cost transparency and trying to get more information in a consumer's hands. But some of the early studies that are coming out about the cost transparency is that consumers are actually making the choice that to go to the higher cost provider based on the transparency, because they believe that because it costs more, it's got to be better. It's got to be better types of care, and it's completely not true. Every study you see, it will show you that there's virtually no correlation between cost and quality in healthcare, you know, which is different. If I go down the street to Best Buy and buy a TV and I pay $2,000 versus $200 for a TV, I have an assumption that $2,000 TV is going to be a better product. And so it's really, how do you get that messaging across to people and really get them to understand that? And I think that's the first key thing. And so we've done a lot of things, constantly trying to reach out to our members, whether it be posting articles internally on our internal intranet pages, creating email communication campaigns on how to drive that and really get to people to understand those different concepts. In regards to your question around savings, I will say in 2022 alone, our savings was well in excess of $1 million from our tiered network structure that we've put into place. And I'll tell you that based on the analysis we've done is that we believe there's significantly more out there for us to get to as well. You know, I talked about before with our tiered network for the Premier, how we offered a lower out-of-pocket cost for people to see a Premier provider. I will tell you there were fewer people that moved to a tier one than we had initially thought, and so to find ways to educate and continue to get more and more to take advantage of that, I think will only help drive even more savings as we kind of go forward and develop these things into the future.
Ryan?
Yeah, I agree with the communication, like Jeremy was talking about. You know, for us, it's really communicating those price differentials. Our employees like to see not only what it's saving them, but what it's saving the employer. So like for a knee replacement, if it's $60,000 off the street and our bundle's $25,000, we'll show them that savings. And then they'll say, well, what's the savings really then to me? We show them that. And then they even further follow up with how many of these are actually done each year. And then when we say, 5 or 6, and then we do the math out, they're like, wow, that's a lot of money. We get it. We need to follow this path. We also have an insurance committee in our district that's made up of all of our employee groups, and it's also spread across all of our buildings. So they go on the journey with us, and they're advisory in nature, but they do have feedback, and we do listen to that feedback, and we do make decisions based on that feedback. So we try to include our employees on the process on these difficult changes.
Hey, Brian. And Brian, one of the questions that came in, the audience didn't catch the wellness company you've been using. Can you say the name again, please?
It's Mobile Health Team.
Mobile Health Team.
Yep.
Thank you. So Mike, let me come to you before I move on to some other questions.
Well, just echoing what Jeremy and Brian said, I think the communication is really key. I think, a lot of people don't realize that healthcare costs, especially for a manufacturer like us, it's the third biggest cost. And it's easy to think about how we're always harping about controlling material costs out there and scrap and we got to get that down and labor efficiency, but you got to have efficiency in healthcare costs, because for us, it's the third biggest cost that we have out there. So when you can let people understand that, and that their actions really control A, the premiums that they're going to face in future years, and B, the amount of profit sharing that they're going to get. Hopefully you get people that are motivated to help save some money. Very important to have that open communication with the folks and share some success stories when you could say, hey, because of your actions collectively, we're not having a premium increase this year. You guys are the ones that did it, not us guys sitting up in the office. It's the people. So very important to get those people involved.
Gentlemen. So I'm having a little bit of a technical issue. So I'm going to ask the question, Brian and Jeremy, if you can go first, Brian, and then Jeremy, and then I'll try to solve my issue. Lori from our audience is asking about what service should one expect from benefit partners, and what do you do if you have significant issues? Brian, can I ask you to start, and then Jeremy can come in?
Yes, I'd be upfront with them, and I would hit it head on. I know it's difficult to hit it head on, but I'd be upfront with them. If they don't change it, I'd probably change the relationship. And in schools, we have a difficult time because we have a lot of relationships built with people. So they golf with them and they trust them, and it's difficult because you're kind of breaking up with someone, and breakups are always difficult. But remember, like Mike was saying, this stuff is our second biggest line item. It's very important. It's important for our employees. It is connected to their pay increases. So if we can keep costs down, they get bigger increases. So I would address it head on and work through it. And maybe they can work through it, and maybe they don't know what they don't know.
Yeah, and I'd echo a lot of what Brian just said. I think the biggest thing is just make sure you have a really clear expectation set out with any of your benefit partners that you're working on. It shouldn't be a surprise on what you expect out of them. And from a service perspective, do they treat you as just another client, or do you feel like they're a true partner that's trying to work with you and trying to have your best interest at hand? So I think those are the key things that I would look at. And Brian's right. It's difficult anytime you have to break up with a partner. None of us enjoy doing it, but at the same time, it's business, and we all need to move the needle forward if we're going to be successful in this. And spending, it can take a lot of time and energy to deal with vendors or partners that aren't performing or meeting your needs. And sometimes it's easier just to cut and move on.
I'd say a red flag too is that the communication is in two ways, or if you're just being communicated a couple times during the year, probably not a great partner. We've had those in the past, and now with my partners, I talk to them almost weekly, if not every other week. It's pretty frequent, but it's needed. Again, it's the second highest expense.
Mike, thoughts from you?
Echoing the same thing that these guys have. It's just a big number, and you just got to keep working on it. And again, if the people that you got engaged to help you work on it, you're not feeling easy with them, then you've got to start looking. Like Brian said, it is tough to break up, but sometimes it's what you have to do.
Do you guys use vendor summits, Brian? I heard you, I think in your introduction, you said sometimes 4 or 5 of your partners come together when you have a question. I'm just wondering if you've used or you're using vendor summits to kind of bring everybody together and solve questions, solve issues, bring challenges to the table.
Yeah, we don't do a formal vendor summit. It's just we created a team. And it's not a summit, it's the team, and the team gets to gather regularly. And if you want to be a partner, that's what it takes. Because again, we all have different viewpoints, we all have different solutions, and no one's right or wrong, but we need them all at the table.
Jeremy, I know we have a lot of meetings. I know your consultant strategist is always in the meetings, but any additional thoughts?
No, very similar to what Brian said. I don't think I have a lot to add. Very similar. We don't have any formal kind of vendor summits, but we do have frequent communication, especially with our big strategic partners, and because those are important relationships, we want to make sure we're trying to grow those and growing together as part of that.
So somebody from the audience wanted to know which MRI provider you use, Jeremy. I think it was MH Imaging out of Milwaukee.
I hate to say they actually, it was a local one that's no longer in business, so it wouldn't do much good to.
But again, if you have questions to our audience, if you have questions, we do now, I am so thrilled. We now have MRI providers that are independent, very high quality, very low cost in, I think, every major market in Wisconsin. We will in Dane County. Dane County was at the very end here. We will by the end of May. La Crosse, Eau Claire, Wausau, the Fox Valley, Milwaukee, Wausau. We have them everywhere. So, let us know. Call us. Give us a call. Give me a call. Send me an email, and we're happy to let you know where to go. So with that, let me see. Are there any other questions coming through? So, before we wrap up, I would like to do a little bit of a synthesize kind of the considerations, partner considerations. So Barb, if you can take us to that slide, the top 10 things to look for in a health plan partner. Experience and qualifications is what we heard. Advocacy and wellness, support, who will service your account and to what extent. Communication, I think we heard it in every single question we asked today. I think communication, and I think I heard all three gentlemen say communication is a two-way street. Compliance and expertise, yes, we are fiduciaries. We're running self-funded plans, and that makes us fiduciaries for our employees and for the financial stewardship of our plan. Day-to-day administration, transparency in data and compensation, length of contract and how to get out of a contract if needed, the renewal process, innovation. I think we heard Mike saying, if my partners don't bring me ideas, but they come back and they tell me, well, I didn't think that you would be interested in this. I'm not going to use the words he used, but I think we got the idea that he would definitely fire them. So these are kind of the syntheses concepts of what we were talking. And we will wrap today's event with these thoughts. Gentlemen, I want to thank you. You always give from your time so generously. Our audience, 175 plus people, and the Alliance greatly appreciates everything that you do to change the ecosystem of healthcare in Wisconsin. And we appreciate your taking time today and sharing your employer perspectives and experience. If you need any additional resources, folks, on the call to our audience, please reach out to your account executive here at the Alliance. There is a code that you can take a photo of and come directly to get in touch with either myself or other members of my team. We do have a significant amount of experience in plan design and networks, and we're happy to assist you. Handouts for this call. I'd like to call out that we have created handouts you can use when you're interviewing potential benefit partners. The questions in these handouts will help you determine if they will be a good fit for your business and your needs. And as mentioned at the beginning of this webinar, to download this resource, click the handouts drop down on your screen. If you didn't get that, get in touch with us, and we're happy to send you the handouts. And as well, a copy of these handouts and the presentation will be at the events place of alliance.org. You will receive an email following today's event with a short survey and directions on how to apply for CE credits. We appreciate any feedback you have as we work, and there is a whole team behind the face that you see here that works diligently to improve our events and bring you as much value as possible. The slides will be made available on our website as well. Just a couple of announcements before I thank you for your time. We're accepting nominations for our annual Healthcare Transformation Awards through the end of May. So please visit our website for details. Again, you can scan the QR code on the screen to access the nomination form as well. And last but not least, our symposium, our spring symposium, it will be another great event. It's coming up on Wednesday, May 17th at the Monona Terrace in Madison, Wisconsin. We have an outstanding program lined up, and we don't want you to miss it. It will be both a virtual and an in-person event, and we're going to have a lot of fun in person. So join us. Thank you again. Remember, when you think of the Alliance, please think self-funding smart. And I want to thank you for the privilege of your time today. Goodbye.